Good afternoon. So, welcome to session 10 of our series of Mastering Anatomy, and in which we are discussing upper limb. Now, say today we'll be talking about hand. Yeah, only hand. In fact, there are very good small muscles, right? So, we'll learn them, and next time, that is tomorrow, we'll be integrating it with forearm. Right. So, good afternoon and welcome all. Say, this was our flow. Last time we talked about forearm, right? And we said this is forearm part 1. Today we are talking about hand, and again that is part 1. And tomorrow we will be having forearm plus hand part 2. So this will give you the complete picture that how exactly things are associated. Why have you really done this right? Why was it done like this? Because there are few muscles which are purely for the forearm. They'll end up at the wrist and that their work is complete. There are few muscles which will be going starting from the forearm all the way. They will be going into the distal phalanges, right? So those who are really crossing the wrist joint, and then same thing will happen in hand, that there are few very small muscles which are dedicated to only the hand. So that's why we'll be telling such muscles as intrinsic muscles, right? Intrinsic muscles, those who are arising from hand and ending in hand only. And obviously rest of the muscles will be calling as extrinsic. Okay. So that's our entire game plan, right? Let's start. So over here, first let's see what we are dealing with, right? Our entire plan would be going something like this, that first we'll have a look at the bones, right? There are several bones and it is necessary to identify all of them very clearly. Because then we'll be taking help of that okay, this will go from this particular bone to that particular bone. So we are dealing with carpels, right? Then there would be metacarpals. On top of it, there will be phalanges. Right? That's it. So we'll be having 8 carpal bones. There would be 5 metacarpal, and for 5 fingers, right? Everyone would be having 3, except the thumb. Thumb will be having only two digits, right? So this first 4 fingers will be having 3 digits. So that's why the total would be landing at 14, and grand total 27 per side, right? That's what we'll be dealing. So here are the carpels. These are the carpels, right? There'll be 8 carpels. So we'll see all of them individually. One more thing, we'll also be talking about muscles, right? After we talk about bones, we'll be talking about muscles. Now these muscles, they'll be arranged in layers, right? So there'll be layer 1, layer 2, layer 3, layer 4, layer 5, everything so beautifully and classically arranged, right? So we'll see this after the bones, right? So let's not worry much about the muscles right now and proceed for these carpels. So these are the 8 carpels. Okay, right? So they are 8 carpels and these are metacarpals. Metacarpals, right? And all of these are phalanges. Now in phalanges, the importance would be like this, that those who are near, so we'll be calling them proximal phalanx, right? Proximal phalanx. Phalanges is plural and this is singular. So proximal, and this one would be distal phalanx. So obviously this in between we'll call it intermediate. It is only in case of thumb there would be only 2, proximal and the distal. Correct? Let's move further. So over here, total, as we said, 27, right? So in anatomical position, say thumb, it goes on the lateral side. So we now say that this side would be our lateral side and this one would be the medial. This orientation, right? Don't lose the orientation, as we'll be going into the depth with one by one layers of the muscles. Few more important things. This little finger, it would be called as digiti minimi, right? That's the only thing which you have to remember. And this thumb would be called as pollicis, right? So when there will be muscle like flexor digiti minimi, so we know that it is for the flexion of the little finger. When this is like flexor pollicis brevis, right? So that means this is a short muscle and it is for the flexion of the thumb. Good, right? So that's what we keep in our mind. Lateral, medial, that was easy. And these are the words which will be coming again and again. Say for example, in case of lower limb, it is called as hallucis, right? Over here it is pollicis. In lower limb, big toe, right? That would be called as the hallucis. Obviously, the movements in the hand, they are much more finer and accurate as compared to our feet, right? So in lower limb, when we'll come to lower limb, we'll talk about the foot. But over here, remember this is pollicis. Okay, so here is our first group, and this is where we'll be talking about carpels. There are 8 carpels, right? Total 8 carpels, and they are arranged in 2 rows, right? So one row obviously will be near, we'll call it as a proximal row, right? 2 rows. So one which is near, we'll call it a proximal, and another one, this is called as the distal. So there are 4 bones in each. So 1, 2, 3, 4, and 5, 6, 7, and 8. So this is pretty clean. Always remember that this counting is from lateral to medial, right? Counting is from lateral to medial. Let's change color, right? And we number these bones. So that will be easier for us. So can I draw something like this, that this is one row and this is second row? True, right? That is one row and second row. So this nearer one, it is proximal, and this distal one, so this is proximal, and that one would be obviously the distal one. Okay. All right. Now let's give the number. So this is easy. This is 1, right? Then this is 2. Then this one is 3. And this one, this on top, that small matar ka dana size ka, there is a small bone, right? That is number 4. So 1, 2, 3, 4. And then for the distal part, this is 5, 6, 7, and 8. Yes, so these are 8 bones, right? So let's see all of them one by one. Always remember some of the keywords so that you never have to cram and you always are properly well oriented. So this lateral to medial, right? It will help you a lot. It will help you a lot when you'll be watching the x-rays, right? Okay, let's move to next. Now we are watching this individually, all bones. Name of these bones, yes, you might have to remember them very cleanly, right? Say first bone, it is starting with S, right? Say there are 1, 2, 3, and 4. There will be 4 bones. Right? I wrote like this, right? So we say that this is scaphoid, lunate, triquetral, and PC form. But who remembers it like this, right? Let's go back. Let's go back. We don't want to remember it like that. And I removed it. This is a better way to remember. Like she looks too pretty. Right? Now this makes some sense. This is easy to remember. Right? So here is our first bone, this one, and this bone must be right. Now for exam, don't say this thing, right? This is just off the record, right? Don't say it in exam, right? In exam, now I'll say what you will say it in exam. This is scaphoid, right? Scaphoid means it is like this. It is a boat shaped bone, right? Boat. So if you make this bone ulta, it looks like a boat, right? So that is scaphoid, right? This is to remember it. Okay. So that is, this bone is, the importance of this bone is it is most vulnerable bone whenever there is a fall on outstretched hand. Reason that this joint, this point is the weakest point, this point, where those two curves meet. If you remember in clavicle, we talked about this, right? Wherever those two curves meet, that becomes the weakest spot. That breaks first. Same thing here. When the fall is on outstretched hand, and when that, it is the scaphoid which will be transferring the entire weight, it is that bone which can break, right? So we'll write this thing as like this, right? This is not hashtag, this is fracture scaphoid, right? So in medical, we write fracture like this. We'll see the x-ray also. Okay, let's move on to the second bone. And that's the number 2, right? And this one, that is number 2. So, right, this is off the record, true. And for the exam, we'll write it like lunate. Lunate. This is easy, right? Lunate, half moon. So let's draw it like this. Half moon. That's what is called as the lunate. Well, it really looks like also, right? This is like a, right? This is like this, right? Half moon. Okay, our moon is like this, right? So this is the second bone. Okay, the third bone. So this is third, right? So now you know that this top portion, it was a separate bone, right? Which we said that छोटे से मटर के दाना size का bone, right? Okay. So this third one, and we remembered it as 2. For the exam purpose, right? We can't use that phrase, right? We have to give some other name. So that is triquetral. Triquetral. Tri means 3. A bone which has got 3 points, right? 3 points. Now, if you look at this bone individually, yes, so there is like, this is 1 point, that's the second point, this is the third point. So it looks like that, yes, it has got 3 points. So it is called as triquetral, right? Easy to remember because number 3 and has got 3 points. Good, right? So triquetral. Moving further, this is our fourth bone. And right from the beginning, we are telling that this bone is of the size of that matar ka dana. That is, it is, for fourth, it was pretty. That's okay. But then this is actually a P-shaped bone. This is a P-shaped bone, right? That is matar. Actually, it is like that. So that's why we'll call this bone as PC form. PC form. That's the fourth bone, right? So we have completed the proximal row. Now there is some speciality of this particular bone, this PC form. In general anatomy, we talk about that there is a concept of sesamoid bone. Sesamoid bone. Right? These sesamoid bones are those bones which are developing in tendon. Right? They develop in tendon. Tendon. Right? Tendon is something which is from muscle to bone. Right? So muscle to bone. Right? Bone to bone is ligament. Okay. So now in this tendon, why it should develop? Because it is giving a form of sling effect, it is decreasing the pressure, or it is giving some directional movement, right? So many possibilities depending upon in which tendon it is. But over here, when we say pisiform, so this should become a favorite question, that this bone is developing in which tendon? So this bone, that's what you have to remember, right? It is flexor carpi. It has to be carpi. It has to be carpi. And because this particular tendon is landing over here. So these are all forming the wrist, correct? They are forming the wrist. So we remember last time we said that there will be, yeah, patella is also a sesamoid bone. It's the largest sesamoid bone, right? In the quadriceps femoris. Okay, so over here in flexor carpi, and this is ulnaris, so we'll say flexor carpi ulnaris. Do remember this, right? Flexor carpi ulnaris. So done. First 4 are down, 4 to go. Now let's move on to the second, or the distal row, right? Distal row. And why should we remember it in a boring way? So we just write 5, 6, 7, 8. Okay. This is just for remembering, right? Don't follow it. Don't do it, right? And if you are doing it, do it at your own risk. Okay. It's like the first one was, she looks too pretty. Well, this is try to catch, I know, her, right? So this is number 5, bone number 5. It is try, right? So from try, we write it is trapezium. Trapezium, right? Trapezium is some, just by look at it, right? Just look at it. It has got 1 side, 2 side, 3 side, and 4 side. So that makes sense. It has got 4 sides. That's why it is called as trapezium. Okay, done. Next one. Right. This one is number 6, and here this 6 was try 2. Okay, try 2. So this one will be called as trapezoid. Trapezoid. Trapezoid is another name of pyramid shaped. Right, it is pyramid shaped. So this is pyramid shaped, right? Now, no wonder, right now you will remember it very cleanly. But sometimes I used to confuse, that's why I am telling you, right? Everything was fine till this point. But then I used to confuse between that it's okay, she looks too pretty, try to, right? Try to, and I was confusing whether it was triquetral or it was trapezoid, because in both the things TR was coming. Then I figured out number of alphabets over here are more and here are less. That means this bone is bigger, so this is like this, and this bone is pyramid shaped, so it is like this. Now it is fine. Now we'll not make the mistake, right? So that's why this is trapezoid, right? And this is trapezium, right? Trapezium, trapezoid, and you must be knowing this trapezium, right? That name itself No, let's not write here, right? It would be confusing. Here, trapezium. Trapezium is something which has got four sides, right? And this is trapezoid. So pyramoid, right? You can remember it like trapezoid is pyramoid. So that it has got three sides. Let's write, right? It is just for remembering pyramoid. So it becomes musical. Trapezoid is pyramoid. So no confusion, right? This is the sixth bone. Moving on to the seventh one. This seventh, it is so easy. You just can't miss it. It is big one, right? So over here also it is catch. Bone name, capitate. Capitate. And it's the largest. Right? Capitate is the largest. Captain, right, is the largest. And the last one. Eighth one. Yeah, that was her. And that's our bone number 8. And this is hamate. Hamate means hammer, right? It is a hammer-like bone. So in hammer, there is a hook, or you can say there is a handle, and then rest of the piece. So same way over here, you can consider that this is something like a handle, and rest of the bone is that hammer itself. So this is what is called as the hook of hammer. Hook of hamate, or hook of hammer, right? Hook of hamate. So thus we saw 8 bones, right? 4 in the proximal and the 4 in the distal part. So this is our next stage. These are the metacarpals, correct? Metacarpals. And the easiest one, we just have to remember that they will be counted from lateral to medial. Bas. This is what you need to remember. And in all these things, we'll always be telling that, okay, this is base, right? So whenever we have to describe anything, that this muscle is attached on the base of first metacarpal, right? So that's over here. And the distal end, right? That would be called as the head, right? That would be called as the head. And in between is the body, right? So every metacarpal will be having head, body, and the base, numbered from lateral to medial, 1, 2, 3, 4, 5. Moving on to the phalanges, right? No big deal in phalanges. That's proximal. This one is distal, and in between would be intermediate, right? And this we have already talked about, that in case of thumb, we'll be having only 2, that is the proximal and the distal, right? Okay. So all bones are done. Obviously, this one is our radius, and this one is our ulna. Okay. So this radius, first let's focus it on only this much part. Okay. And this radius is in connection with our first bone, right? That boat-shaped bone, because that's the bone which will be taking the pressure and will be transferring it to the radius. So that pressure line would start from the scaphoid and then it will go to radius. So whenever there is high pressure, so it is the scaphoid which is taking the brunt of that pressure first, transferring it to radius. So if these bones are not strong, then chances of fracture of scaphoid very high. Same way, chances of fracture of radius, they are very high, which is called as the Colles fracture, right? Fracture of the wrist. So that's the reason, because that pressure line is going all the way. That's the reason that when we were discussing the clavicle, right? The clavicle is also like that. It is coming into that pressure line where it is transferring the weight from the arm to the central axis of the body, and then that's the point where it breaks, right? Okay, so coming back to this, easy to see that here is the scaphoid. And which bone is this? Right? So this is scaphoid. Scaphoid. And the second one over here, half moon shaped, right? Shape is so clean. That is lunate. So that's the thing. Over lunate and the scaphoid, they both are articulating with radius. Now even these carpels, they are also attached with each other. So that's why there is a general term, right? We'll just put a general term and general term, it would be intercarpal joints, right? Intercarpal joints. As such, they all are connected, but we'll see which whatsoever is important. Otherwise, as such, everyone is connected, right? Then these were the carpels, and these are what? Metacarpals. So carpels and metacarpals. So whenever we'll be defining these particular joint, we'll be telling that these joints are CM joints. Carpo, metacarpal joints. Defining all these terms, defining all these areas is important, because when we'll be talking about any of the specific muscle, immediately we'll say that yes, it will be giving extension to the proximal and distal, that interphalangeal joint, or it will be giving flexion at carpo metacarpal joint, because it will make things very clear, right? That is exactly what we are talking about, right? So remember, intercarpal joints were there, and this is carpo metacarpal joints. These were the carpels, and these are all metacarpals. Yeah, now it is done, right? So if that was carpo metacarpal joint, so over here, these are the metacarpals and these are the phalanges. So yes, we'll be calling them MP joint. Right? Metacarpo phalangeal joint. Right? Metacarpo phalangeal joint. Obviously, only the proximal phalanx will be able to come, right? The distal phalanx cannot jump and come into association with this metacarpal, right? So obviously it is between metacarpal and phalanx. Next, now here it is, interphalangeal, between phalanx, interphalangeal joint. So we'll call them IP, correct? IP joints. So we were having carpo metacarpal joint, metacarpo phalangeal joint, and interphalangeal joint. Right? Now it is making sense, right? Because things are not that complicated, just the names are there. And in joints, we have got two, right? Because this was proximal, this is intermediate, and this one is distal. So now we are dealing with two joints. So one is near, one is away. So we'll call this as the proximal, right? We'll call this as proximal, and this one will be called as the distal, right? Proximal and distal joint. Distal joint. So proximal interphalangeal joint and the distal interphalangeal joint. In easy way, this is PIP and this is DIP, right? This one, this joint, it is metacarpo phalangeal, and these joints, they were carpo metacarpal, right? Quite easy, right? It is not as complicated as it really looks like. So carpo metacarpal, metacarpo phalangeal, we have got the proximal interphalangeal and the distal interphalangeal. So if that's the case, what about you? I know you have guessed the question. What name should be given to this particular joint, right? Because it is between what, right? This one, metacarpal. This would be this. Sorry, this one would be metacarpophalangeal, and this is proximal interphalangeal or distal interphalangeal. It is named just interphalangeal, right? That's it. So it is interphalangeal joint. Let's move further. So here it is. That's how the scaphoid can really break, right? So it is what is called as the fracture scaphoid. Here it is. See, that's the scaphoid. And here it is, the fracture. See the irregular margin. So that's how it breaks. Now we move on to the muscles. Muscles of hand. Now in order to learn muscles of hand, we need to go layer by layer, right? As they are arranged into 5 groups, right? 5 groups. And these 5 groups, they have got some very typical name. So first we just talk about that there would be a group called Thenar. There would be another group called Hypothenar. Now as the name looks like, but see it this way. T is for thumb, right? So Thenar is for thumb. Thumb. Yeah. Thumb. Hypo means always small. So it has to be towards the little finger, right? Towards the little finger. So we just say towards, let's write towards little finger, but no, now we are more scientific. We learned one word called digiti minimi, है ना? Digiti minimi. So I'm writing digiti minimi. Right? This is more impressive. Little finger to everyone knows. This digiti minimi, it looks stylish. So let's say it is digiti minimi. But the point is that these muscles, they will be towards the side of that little finger. So when you look at your hand, right? When you look at your hand, so these muscles, they are thenar muscles, and these muscles, right, towards the little finger, they are the hypothenar. Okay, so these 2 groups are done. Rest of the 3 groups, they are lumbricals. They are worm-like muscles. They're very small muscles, right? But interesting muscles. We'll see. But all you have almost finished, right? Then there are interossei. Oh, this name. Name itself is telling that it will be between 2 bones, right? So many bones are there, so obviously between the 2 bones, these are interossei, but they are in 2 groups. So there is dorsal interossei, and then there is posterior, the ventral interossei. So we'll be having, right? So right now, what we do is palmar interossei and the interossei, right? And the dorsal interossei. So we'll dorsal palmar. These are the 5 groups we should be dealing with. Let's see the first group. Now again, all these are intrinsic, right? Are all intrinsic. So little small muscles, right? They are over there. And as we said that this is the first group which we are talking about, that is thenar, right? Near thumb. Who remembers such names? Because the names are bit ajib, right? It is. So we just remember one thing, and it is all for one. All for one. This is all for one. Okay. A, this is thumb. This is thumb, right? So we have the movements like abductor, adductor, flexion, extension, right? Flexion, extension, abductor, adductor, abductor going away, adductor coming near. So over here, this is the same thing, and then later on we'll see. But if you remember just this all for one, so this first one muscle is abductor, abductor, right? Second one is flexor, right? Third one is opponents. Now interestingly, same order will be even on the opposite side also. So by this way you will also learn that in which layer they are arranged. Abductor. Now this is thumb. So you remember what we called it? We called it as pollicis, right? So let's finish this. Pollicis. Pollicis. And the third one is pollicis. You have almost completed everything, right? Now these muscles are not long, these are short muscles, right? So abductor pollicis longus, yes, there was a muscle. Flexor pollicis longus, yes, there was a muscle, right? So we can't call them longus, so we call them brevis. So all internal muscles, they are short, so they will be brevis. So flexor pollicis brevis. And then we might be tempted to say opponents pollicis brevis, but then opponents pollicis will say, Baba, there is no other muscle with my name. I am the only one. So we'll say, okay, fine. So then we don't add anything to you, right? Done. These are the muscles, right? Abductor pollicis brevis, flexor pollicis brevis, and the opponents pollicis. By the way, opponents is this, right? When you, this count, right? This is that opponents, right? When you do it like this is opponents. Okay. So abductor pollicis brevis, flexor pollicis brevis, and the opponents pollicis. But then there is one more muscle, right? If there is abductor pollicis brevis, so we need to add adductor. And as this is for thumb, so we say adductor pollicis, right? So that's it. So we just give the name 1, that's 2, this is 3, this one is 4, right? Don't underestimate adductor pollicis, right? It has got some good secret, right? We'll talk about, it will come within 2 minutes. Okay, so here is our first muscle. Now it is simple. Abductor pollicis brevis. So here is our abductor pollicis brevis, this first one. So we'll write it like abductor pollicis longus, right? Now onwards we'll start using our shortcuts. Not longus, right? Why did I write longus? It has to be abductor pollicis brevis. True, right? So that's abductor pollicis brevis. Moving on to the second one, just underneath it, right? So this one, abductor pollicis brevis 1. So this one 2, which was flexor pollicis brevis, that's number 2, right? So these two are done, 2 to go. Yeah, here we have removed that. So abductor pollicis brevis, which was on the top, it has been removed. So that's how we write, right? When we remove a muscle. And this one, it has to be flexor pollicis brevis. Now in full view, right? So let's write it in full view. We are again coming back to these images, right? In case if it is not clear, once again we'll see that. Plus we'll add some information in that. First have a look at the complete geography of these muscles, that is how they are arranged. Okay, we removed even that flexor pollicis brevis. So just for our abductor pollicis brevis we removed first, then we removed flexor pollicis brevis, yeah, that was number 2, all for 1. So this is O. O is what? It is opponents. Opponents of what? Well, obviously this is pollicis, and pollicis is actually unique, right? So that's opponents pollicis, and here it is opponents pollicis, right? Very well. Okay, before that, let's go back, right? We are going back, and this is abductor pollicis brevis. So we are adding a small piece of information, and this information is that who is supplying it, right? You remember ulnar nerve, right? And then there was deep branch. That deep branch will come over here. So this abductor pollicis brevis is by deep. Oh, I think this is not read clearly. Deep branch of ulnar. Right? Okay. The next one is flexor pollicis brevis. This flexor pollicis brevis is interesting. Flexor pollicis brevis, right? Muscle is small, but it has got double nerve innervation. Double nerve innervation. No big rocket science, right? Which two nerves? Obviously, only two nerves they successfully reach over here. Otherwise, the rest of the things, rest of the muscles, they ended their career high above, right? Only two of them. One, we know it is the ulnar nerve, and second one is the median nerve, right? Only these two successfully reached over here to supply the muscles. So over here, this is like a FPB, right? This flexor pollicis brevis, they go for the joint operation. Right? So it looks like FBI, right? And then joint operation, right? These words are like striking the brain, right? So that's why here also, whenever this mysterious name, right? Flexor pollicis brevis, right? Speak it in style, right? Flexor pollicis brevis, joint operation. So you will always remember that it has got double nerve. Importance, when we'll see the clinics, one session will be keeping, the last session will be keeping, which will be next week, only for the clinics, clinical association of the hands, where we'll be discussing right from the beginning, right, all the way to clavicle to scapula, what can go wrong, what type of fractures, right? Only clinical part. That's where every piece of this information will come into picture, right? Though we have discussed like Orb's palsy, etc., right? Brevis means small, short. So everything will come up into that, right? But at that point, obviously, we'll not be entering into the details of every part, right? Because if we'll go for that, then we won't be able to complete it. That would be a complete focus. If you have seen all these sessions, you'll find it very interesting, right? So that's how we'll go. Let's move on to the next one. Yeah. Fine. We talked about it, that this is the flexor pollicis brevis, and this one is the opponens pollicis, right? More details as we reach to that. Here is the fourth one. This fourth one is adductor pollicis, right? Adductor pollicis. Nothing like longus, nothing like brevis, purely adductor pollicis. This adductor pollicis, why it is special? Because it has got two heads. It has got two heads. One is the oblique head. One is the oblique head, and second one is the transverse head. By the way, I wrote this thing obliquely, not deliberately, right? Just I was trying to write it a bit fast, so it got oblique. This is the oblique head, right? that is the adductor pollicis, oblique hand. And here it is, this is the transverse head. That is of adductor pollicis. This is also supplied by deep branch of which side? Ulnar side, right? Ulnar nerve, deep branch of ulnar nerve. Okay. Now this is hypothenar, right? That is hypothenar. Now in hypothenar, that means we'll be dealing with digiti minimi, right? Digiti minimi. To make things proper, right? So that you don't have to even struggle on remembering such typical names. And yes, it happened to me that first time when I was studying hand, I found it so complicated, right? I was finding it very difficult to remember. So let's avoid that entire pain. I'll give you 30 seconds, right? In your books, just write down what was all for one for the thinner side. For the thinner side, what was all for one, right? Here I am writing all for one. And then there was one more muscle. So what was that? Because if you write it correctly, I don't have to teach you hypothenar. You'll know it automatically. Right? So just very fast, write it down. Right? It would be abductor, pollicis, brevis, flexor, pollicis, brevis, opponens, pollicis, right? You can write it in short, and adductor, pollicis. Good. And just pick up abductor, flexor, and opponents. Take it on this side, right? So we say abductor, then flexor, and opponents, correct? And this is for digiti minimi. So abductor, digiti minimi. Now for such a small finger, right, there is nothing more like, say, for longus and etc. It is just a simple name. Similarly, flexor, we are dealing with little finger. So flexor, digiti minimi, right? Same way. Opponents, digiti minimi. So easy to remember, right? And then remember this palmaris brevis. Right? I used to remember it like Palm Beach, right? So palmaris brevis. When these names are so easy, right? So that is like a Palm Beach. Done. As such, you have remembered all the muscles of thenar and hypothenar. Just remember all for none, all for one, right? All for one. So this is abductor pollicis brevis, flexor pollicis brevis, and the opponens pollicis. This is abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. And things will be going exactly in this order, the way it went into this side, right? Let's see that. So first one, this. It is that muscle which we said Palm Beach, right? It is this. Palmaris brevis. So this extra one, right? He enters first. Over here, this adductor pollicis, which was having two heads, he was at the end. Over here is this Palmaris brevis is first. No problems, right? This one, the first one, right on top. So it was a abductor, correct? Digiti minimi. Digiti minimi. And that deep branch of ulnar is with such a big heart, right? It will give supply to this muscle also. So this is abductor digiti minimi, all for one. So next one we expect with flexor digiti minimi, right? Even without that figure came, image came, we were expecting this and we were right. That's what it is called as flexor digiti minimi. Name is telling every function of it. Supply, same big hearted now, right? Deep branch ulnar. So this is also done. The third one, whom are we expecting? The only left out, right? Opponents digiti minimi. So here it is. That chota sa muscle, right? This is opponents digiti minimi. Right? So when we do like this, dhyan, right? It is that muscle which is used. Again, supplied by big-hearted, right? Deep branch, right? Ulnar. So let's draw this now onwards like this so that we remember that this is a big-hearted nerve, right? Nerve, which is supplying all these small muscles, right? So opponents digiti minimi, yes, it is this. So two down, right? You have finished thenar and the hypothenar, right? That was thenar and the hypothenar group. This is done, this is done. Okay, now comes 1, 2. Now comes the group 3. And this third group is those worm-like muscles, lumbricals. Lumbricals. So many lumbricals. So we'll start naming them 1, 2, 3, 4, right? So 1, 2, 3, 4. But when we say 1, 2, 3, 4, from which side? Same rule. Lateral to medial. So in such case, right, this would be 1, this is 2, this one is 3, and that one is 4. Right? 1, 2, 3, 4. So 1 and 2 and 3 and 4. 1 and 2, if you see, these are having only one part, right? Single pattern. So they are supplied by median nerve. Median nerve. And 3 and 4, they are dual, right? Arising from two portions. So this is by same, right? Ulnar nerve. Ulnar nerve. Deep branch. But then from where are they arising? Now see, something is coming from here, right? I'll change the color here. So those tendons which are coming from the top, right? They are like flexor digitorum profundus. Profundus, right? Something which was coming from all the way from the forearm and it is coming over here. So these tendons of flexor digitorum profundus, they are giving support to these lumbricals. Yes, you can take origin from my tendons. So that's what really happens. Now this is very, very typical, right? So let's see it properly. Here it is. That's the tendon of flexor digitorum profundus, this one, right? And then here is one tendon, here is another tendon, and then these muscles, right, they will be arising like this. Right? Multipated or single pated. So this is like it has got two parts. So that's how this is what happens in 3 and 4. And like this, it is happening in 1 and 2. So lumbrical 1 and 2 like this, lumbrical 3 and 4 like this, right? This is for 1 and 2. Okay. Completely separated to make it very clear. So these lumbricals, when they are so typical, what exactly they do? To remember this thing, you have to actually do it with your hand, right? First, find out, right? What we are about to learn is the functions. First, find out functions of lumbricals. Where is your, if I say MP joint, can you really figure out in your hand where is MP joint? I'll just say MP joint. I'll not say full form, right? MP was what? MP was metacarpophalangeal. True? So metacarpophalangeal. So where are metacarpals? These are the carpels, right? So these are your palm is your metacarpal. Then metacarpals, they are arranged with all these 1 digit, 2 digit and 3 digit, right? And that's how they are arranged. So metacarpo, these are the metacarpals, right? And then these are the phalanges. So these knuckles, right? These knuckles, can you make out, right? Those knuckles, they are your MP joint, metacarpophalangeal joint. And when I say that these metacarpophalangeal joint, when you flex it, right? So say thanks to lumbricals, right? So this is flexion of metacarpophalangeal joint. Good one, right? But wait, there is something more. Now find out where is PIP and DIP, right? What was that? PIP and DIP, right? Can you really locate your PIP and DIP joints, right? DIP joints. Yes, you are right. This is PIP, this is PIP, and this one is DIP. Proximal interphalangeal joint and distal interphalangeal joint. True? These two. Okay. So it will lead to extension. It will lead to extension of PIP and DIP. True? Now try to do this thing. So metacarpophalangeal joint flexion, right? And proximal interphalangeal and distal interphalangeal extension. So that's what it is doing, right? When you want to hold something, right? So this is what is giving you strong grip, right? I tell you one more interesting thing about lumbricals. Oh, wait. One more interesting thing about lumbricals. Lumbricals are used whenever you are writing, whenever you go for upstroke, right? Lumbricals are used. So if you like, say, let's write lumbrical itself, upstroke, right? So say thank you, lumbrical, right? Upstroke, 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 right? Upstroke, upstroke, up, 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 up. See, so many times, even in writing lumbricals, right? Every upstroke is using lumbrical, right? We'll just say upstroke. So that's the third group which you have finished, right? So 3 down, just 2 more groups to go. The group number 4. Group number 4. See, tendons are over. Now we are over there to bare bones, right? Simply bare bones, right? We are now into that depth. Only the bare bones are there. So now the dealing will be between 2 bones only. Right? That's why this group, they will be called as interossei group, interosseous group, right? So we entered from here, right? And then we are trying to come out from here. So this side is palmar, right? This is palmar. So let's call it palmar interossei. Palmar interossei. That is between bone. Again, supply, I'm just drawing this. You know it, right? It is deep branch ulnar. Excellent. Right? And this palmar interossei, remember, pad and dab. Right? Do remember. Palmar is for adductor, adduction, right? So these palmar interossei, they are for add, that is adduction. Adduction. So when you are closing your fingers, right? Simply speaking, so just I'm removing this dab from here to avoid confusion. Okay. When we'll be talking about dorsal interossei, we'll write it there. So just say closing your fingers, right? So that is palmar interossei. This is now group 5, the last one, dorsal interossei. Because once you remove this, right, but that's it, then there are only bones, right? So these are once again 4 short bones, short muscles between 2 bones, right? 4 short muscles between the bones. Supply, same big hearted, right? Deep branch, ulnar. And these are dab. So dorsal interossei, they are for abduction. Right? They are for abduction. So this is what is called as abduction, right? Abduction. Now see these muscles, their arrangement. Again, they are numbered 1, 2, 3, 4. So 1, that's 2, this is 3, this is 4, right? So same order, same style. Now this I am preparing you for the tomorrow's session. Tomorrow will be the session where these mysteries will be clarified, right? That something which is coming from forearm and then they are playing some role in the hand. So that's why this connectivity is what we'll see tomorrow. Over here, as this is interesting, so that's your thumb, right? Over here, this is the space which is called as the anatomical snuff box. This anatomical snuff box we really want to see, right? Where exactly they are. Now one thing is clear, that for this anatomical snuff box, the muscles, snuff box, right? It is this area. It is this area. That's the area which we are talking about, this one, right? So this area, it cannot be with the help of intrinsic muscles. Muscles, they have to come from outside. So yes, they all will be the extrinsic muscles, right? They will be arising from forearm and then they are coming into the palm. So here it is, 2 muscles on the outer aspect, 1 muscle is on the inner aspect, right? 2 muscles which are over there. Let's see. Abductor. right? This has to be polysis, right? And see, all the way it is coming from the top, right? Abductor polysis brevis. अरे नहीं, brevis was तो that छोटा सा muscle that was into that thin arm, right? He has to be longus. Yes, so it is longus. That's one muscle. The second one, extensor polysis brevis, right? This muscle, it will be arising from here and it will travel for a shorter distance because there will be a longer muscle. Yes, we'll see all those muscles tomorrow, right? Even these will also be revised. So they form one wall. And what about this? Well, that is extensor. Again, it is polysis longus. How come? And if you trace this muscle, right, you'll find that yes, it is traveling for quite a long distance, right? So keeping it simple, 1, 2. This is abductor, right? Abductor polysis longus, extensor polysis brevis, and then that's the anatomical snuff box. Snuff box. And this third one is extensor polysis longus, right? This much you just see, and let's have a closer look. This is better, right? So that's where things will be going. And let's see something interesting. This is the radial artery. Radial artery is something which is going into this anatomical snuff box. Snuff box. Radial artery, right? No doubt there would be, if there is artery, then there has to be a vein, there has to be a nerve, right? So for the vein, this is, so for the vein it would be cephalic vein, right? And for the nerve it would be the superficial branch of, side itself is radial, so radial nerve, superficial branch of radial nerve, right? Smaller ones. But that area itself, this one, that is anatomical snuff box, right? So that's it, was for, say, today's session, right? For the hand. Now tomorrow we'll be integrating all these things. And today at 9 o'clock, right, in the night, we'll be handling a very special session, and that session is handling pressure efficiently. As I was getting several mails about that, we are overwhelmed with so much of books, so much of notes, so much of studies, that how to really work out, how to handle so much of books, so much of the material which is to be studied. This particular session, it is not only for medical, but it is anything for in real life, right? Whether that pressure is of work pressure or it is of some performance pressure, anything. How to really tune your brain for better efficiency, right? Because otherwise, everyone has got 24 hours, everyone has got 365 days only in a year, right? There is no partiality that few minutes or few hours they are more given to someone. No, it is same for everyone. So one thing is clear: if you don't manage your efficiency engine properly, it is difficult to perform, right? Whether it is the physical fitness or it is your mental fitness. So that's what we shall be talking about in handling pressure efficiently, right? I'll do it. regarding it also. Sure. So all right, thank you so much, right? And we meet very soon. Thank you and take care. Bye bye. Yes, we shall be starting about physiology, and actually we'll be starting it very soon. Very soon. In fact, tomorrow we'll be taking this forearm and hand, and next week, right? Next week, our first session, that would be, in fact, it would be the last session for upper limb. That would be for the clinicals, right? Once that is complete, so planning for physiology. Yeah, sure, right? So I'll update you even before that. Thank you.